Welcome to another episode of EKG with Tutor Furtari. Today we will be doing a chapter review that is gotten from this particular textbook. I'm going to be putting the photo right there and we'll be doing the chapter 1 review. Why exactly am I doing this? And that's because I realized that during my EKG and CCT exams, those questions, a whole lot of the questions from the textbook appeared in those exams. So today we're going to be doing the chapter 1 and I will be putting up the pages of my book so you can follow along. The first one has to do with matching. So we're expected to match the right answers on the listed 1 to 8 options with the listed A to H option. So let's go with number 1. Number 1, cardiovascular diseases. What is cardiovascular diseases? Take your time and look through it and figure out the answer. If you have to pause this, you just pause it and then you press play once you know your answer. If you chose F, the answer is F, and that is disease related to the heart and blood vessels. Number 2, electrocardiogram. What is electrocardiogram? If your answer is B, you're correct. A tracing of the signal produced by the heart's electrical activities and used for diagnostics evaluation of the heart. 3. Coronary artery disease. If your answer is D, the narrowing of the heart's blood vessels that causes a reduction of blood flow to the heart, you are correct. 4. Standard precaution. Standard precaution is H. Guidelines that apply to blood, body fluids, secretions, and excretion except sweats, followed when there is a possibility of exposure to blood or bodily fluids. Number 5, electrocardiograph. What is electrocardiograph? The answer is A, an instrument used to record the electrical activities of the heart. Number 6, defibrillator. Defibrillator. Defibrillator answer is G, a machine that delivers an electrical shock to the heart that is intended to correct the abnormal electrical pattern of the heart. 7, AED. AED answer is E, used to analyze the heart rhythm and produce a shock if necessary. The last one is isolation precaution. The answer to isolation precaution is C, the second level of protection against the transmission of disease based on how the infectious agent is transmitted. I did make a video stating the difference between electrocardiograph and electrocardiogram a while ago. It's a very short video. I did state some very simple facts. The next question is a true or false question. So the first one is an AEG machine records the electrical activities of the heart. True or false? The answer is true. 10. Standard precautions are guidelines written for healthcare providers to help prevent the spread of infection. True or false? The answer is true. 11. Libel is the act of making derogatory remarks about someone. True or false? The answer is false. Libel is when you write a derogatory remark about a patient, while slander is when you say it. The next true or false question, number 12, false question number 12. A telephonic monitor transmits an ECG over the internet. True or false? If your answer is true, you are completely wrong. The answer is false. Telephonic monitor transmission has to do with transmitting over the telephone. 13, true or false? Because an ECG is not an invasive procedure, it is not necessary to wear personal protective equipment, PPE, when performing this procedure under any circumstance. The answer is false. You should always put on your PPE, your personal protective equipment. Multiple choices. Number 14. The normal range for an adult's pulse is A, 40 to 80, B, 50 to 60, C, 60 to 100, D, 90 to 120. If you answered 90 to 120, you're completely wrong. The answer is C, 60 to 100 beats per minute. Number 15. Which physician received a Nobel Prize for inventing the electrocardiograph? A. Augustus D. Waller. B. Sir Thomas Lewis. C. William Einthoven. D. Joseph Leister. The answer is C. William Einthoven. 16. The main responsibility of an ECG monitor technician is to A. View and evaluate ECG tracings on an electronic display and alert heart healthcare professionals when abnormalities appear. B. Attach the ECG electrodes to patients who will be monitored remotely. C. Assist physicians with angioplasty, heart surgery, and implantations of artificial pacemakers. D. Perform ultrasounds on patients' blood vessels. What would be your answer? The answer is A. To view and evaluate ECG tracings on an electronic display and alert healthcare professionals when abnormalities appears. 17. Which of the following is a reason for performing an ECG? A. To evaluate heart conditions. B. To check for problems with the flow of blood through the heart. C. To see how well the veins are contracting. D. To evaluate the rates and rhythm of breathing. The answer is A. To evaluate heart conditions. 18. A defibrillator can be used to A. Treat an abnormal heart rhythm. B. Without training. C. To produce an electrical rhythm. D. To record the patient's breathing patterns. What would the answer be? It is not B, it is not C, and it's not D. It is A, to treat an abnormal heart rhythm. 19. Telephonic monitoring allows for information to be A, reviewed immediately by the patient, B, transmitted over a telephone, C, submitted for billing purposes only, D, recorded by a computerized device. What will the answer be? The answer is B, transmitted over a telephone. Telephonic, telephone, telephonic, telephone, telephonic, telephone. It's that simple. Okay, so let's go to the next questions. 20. A continuous ECG monitor is used most commonly in A, physician office, B, hospital, C, assisted living center, D, clinic. The answer is B, hospital. 21. A person whose blood pressure has been above normal for 2 or more doctor's visit may be diagnosed with A, low cardiac output, B, low blood volume, C, hypertension, D, hypertension. The answer is D, hypertension. To write, to write derogatory words about a patient is A, slander, B, libel, C, a HIPAA violation, D, ethical. The answer is B, libel. Libel is not ethical, is non-ethical and not legal. 23. Your most important duty includes watching an ECG tracing and notifying the physician of abnormality. You are most likely A, ECG monitoring tech, B, cardiovascular technologist, C, ECG technician, D, physician assistant. What would the answer be? The answer is ECG technician, C. 24. Which of the following measuring which of the following measures help ensure that your patient's information is protected? A. Standard precaution. B. OSHA. C. Patient precaution. D. HIPAA. The answer is D. HIPAA. 25. What's the amount of time? What amount of time is the respiration rate count based upon? A. 10 seconds. B. 15 seconds. C. 30 seconds. D. 60 seconds. The answer is C. 30 seconds. What is the single most important procedure you can perform to prevent the spread of infection? A. Standard precaution. B. Hand hygiene. C. Patient education. D. Communication. So for this question, I would like you to type the answer in the comment section. Is it A. Standard precaution. B. Hand hygiene. C. Patient education. Or D. Communication. 27. When speaking to a person who is hard of hearing, it is important to speak A. in a high pitched voice. B. Rapidly. C. Slowly and distinctly. D. Loudly. The answer is slowly and distinctly C. The next questions. 29, 28. Which of the following is not considered a vital sign? A. Blood pressure. B. Pain assessment. C. Urinary output. D. Respiration. What would the answer be? If your answer is pain assessment, you're completely wrong. The answer is C. Urinary output. 29. Which of the following is the most common pulse point for measuring an adult's pulse? A. Radial artery. B. Popliteal artery. C. Brachial artery. D. Temporal artery. The answer is A. Radial artery. 30. The systolic blood pressure represent the blood pressure when A. The right atrium relaxes. B. The left ventricle contracts. C. The right ventricle relaxes. D. The left atrium contracts. You see, in questions like this, there's just one answer. Most of the time, systolic pressure and diastolic pressure is focused on what part of the heart. Like most of the ECG is focused on one particular aspect of the heart, and that is the left ventricle. So the only answer here that is logical is the left ventricle contracts. That is the answer for this question. B, the left ventricle contracts. 31. A patient's pulse is an indirect measure of A, blood volume, B, blood viscosity, C, vasocontraction, D, cardiac output. Number 31's answer is D, cardiac output. 32. Which of the following is not a specific type of isolation precaution? A, AIDS precaution, B, droplets precaution, C, airborne precaution, D, contact precautions. The answer is A, AIDS precautions. Critical thinking. 33. You have been performing an ECG at a local clinic for about 6 months. Your favorite uncle says to you, since I just turned 40, your aunt thinks I should have an ECG. Will you do one on me if I come by where you work? What would you say or do for your uncle? Consider the following. 1. Should your uncle have an ECG? Yes, your uncle should have an ECG, and it should be ordered by by your physician. Yes, your uncle should have an ECG, and it should be ordered by the physician, not casually you. You should follow your company or the hospital's policy. B, should you do the ECG if he stops by your office? Why or why not? No, you cannot do it casually. It has to come directly via a physician. And if it is you who happen to be the person to do it, that's different. But you have to follow your company's policy. And no, you are not licensed to decide if he should have the ECG or not. So, no, he has to go via the physician or a licensed practitioner. The next questions, the next set of questions. The patient has been having some mild chest pains during the ECG, and the patient says, "How does it look? Is there anything wrong? What should be your best response?" You should calmly tell the patient that you are the ECG technician and it is your duty to perform the ECG, that their provider will get to them with the results calmly and respectfully. Okay? 35. You walk by a room where a coworker is performing an ECG on a female patient. The door is open and the patient is not covered. What would you do? The patient's privacy is very important. So the first thing you do is to close the door. That's all you have to do. You don't walk there trying to correct your coworker or covering the person. Just close the door. Okay? Privacy is very important. Close the door. 36. You're responsible for monitoring the heart rhythm of six patients at a local hospital when you began to feel ill. You're in desperate need to go to the restroom and you really want to go home. What should you do? Go to your supervisor. Go tell your supervisor you are not feeling well, you're not feeling okay, and you need to go home. Tell your supervisor, do not just leave your patient, so that your supervisor can either get someone to fill in or they fill in themselves. But do not just leave the vicinity, okay? Well, that's all for chapter one's review. Make sure you check my next video for chapter two reviews. And like I said, this would really help with exams. And I have seen a lot of these questions come out in the exams I wrote. Till next time. Bye.